Hello. I want to talk to you now about receding gums. If you've got receding gums, this is honestly probably one of the most important videos you're going to watch, so please watch it. And if you think, what do I know about receding gums? How about this? They're pretty well receded, aren't they? But all is not what it seems. Let me tell you the full story. I'm going to share with you something that will save your teeth. If you've got receding gums, I'm going to share something with you that your dentist won't tell you, your orthodontist, your periodontist, whatever they call them. Recently, I had an accident. I lost the front teeth, so I decided to have dental implants. And I went along to see the dentist, and he said, yeah, we can put a dental implant in there, and we can put a dental implant in there, and we can put a bone graft in across the top there to thicken the jawbone up, and then we can stretch the gum down over the top and stitch it all up again. In about 3 months, when it's all healed, then we can screw a dental bridge in place. I thought, fantastic, right, that's what we'll do. Well, it didn't go to plan. I'll tell you why. He did all this dental surgeon. He was very highly recommended, and I'm not complaining about him at all. He gave me one lot of antibiotics before the operation, and he gave me a week's supply after the operation, 2 separate lots of antibiotics after the operation. And I felt crap for a week. My whole of my gums was swollen. I couldn't eat properly, I couldn't talk properly, I couldn't drink properly, couldn't sleep, couldn't go to work. I couldn't even put these dentures back in because the whole thing was swollen. Now, I make a living from natural remedies, but I had to place my trust in the oral surgeon and the antibiotics. I did, because they're specialists, they know what they're doing. And I still would have taken antibiotics again, but after 1 week I still wasn't eating properly. My gums were like red liver, so sore and inflamed and tender and bleeding and pus coming out, and it was a mess. And bear in mind, at this stage I'd had 3 lots of antibiotics, and they'd recommended all kinds of fancy mouthwash that didn't work. That one didn't work, that one didn't work. This fancy dental gel didn't work. My gums were a mess, I was in pain. The painkillers didn't work, ibuprofen, tramadol. I even tried buying my own stuff then from the shop. I was trying everything, trying to help my gums because they were inflamed and in pain. After a week I didn't know what to do, but the antibiotics had finished. And I thought, I know I've got a remedy called Gum Doctor. It can't be any worse than the antibiotics. And I came up with this 22 years ago, and it was for people with bleeding gums, with receding gums, with spongy gums, and gingivitis. What it does, I'll show you how easy it is to use. Now bear in mind, I didn't even have my gums were so sore and swollen, I couldn't even wear dentures, so I had no teeth, I couldn't go to work. So I couldn't even touch my gums, they were that sore. But I went like this, that brown liquid, and I just massaged it into the gums. And after a few minutes, I thought, am I imagining this? The pain started to subside. I left it an hour and I put some more on. And put some more on at bedtime. The following morning I was able to eat my breakfast for the first time since this dental surgery. The Gum Doctor, which was originally designed for bleeding gums and receding gums, sorted out this whole mess that was in my mouth. Less than 2 weeks ago, my gums were a mess, and look, I can hit them as hard as I want. Them gums are healed now, they're healthy. What's going to happen is, in 2 months' time, I'm going to go back to the dentist and he's going to screw in a dental bridge, and that'll be the end of it. But I want to talk to you now about receding gums and how to treat your receding gums. Obviously it's really important that you see a dentist so that your dentist can see is there any other reason, for instance plaque or some kind of, if there's a reason why your gums are receding. And your dental hygienist will be able to scrub and descale your teeth. But your gums need a helping hand, just like my gums needed a helping hand. Antibiotics, fancy mouthwashes, fancy gel, painkillers, all the other crap doesn't work. Didn't work for me. Didn't work, otherwise I wouldn't have bothered with it all. It didn't work. The gum doctor. I haven't used this for 15 years. Apart from having a few spongy gums, and once I had a bit of a receding gum and I used it for about a week. This was 15 years ago. I used this after I used the antibiotics. I gave the antibiotics my best shot and I still would do again. But I'm saying to you, if you've got receding gums, get the gum doctor and get it shoved on. And put it on where the tooth meets the gum. So if that's your socket, there's your tooth. Get it massaged in and massage it in every day. Several times a day. It'll strengthen your gums. It'll harden your gums. The gum doctor, in conjunction with whatever your dentist can do for you, will give you the best chance of saving your teeth. See, you've seen my story. I've not made it up. And in fact, I'm so damn proud of this stuff that I am prepared to show them, sit in public with no teeth and say, look, that stuff saved the day for me, and it can save the day for you, and I hope it does. I hope it does everything for you that it did for me. It'll strengthen your gums and save your teeth. Now in a month's time or 6 weeks time, I'm going to have dental implants in here, the bridge screwed in, and everything will be fine. But if you've got receding gums, you need to give your gums a helping hand, and that's what the gum doctor does. You've seen how easy it is to use. It'll do everything for you that I'm saying it'll do for you. And if it doesn't, you can have your money back. It's that simple. But it does work. You've seen what it's done for me. And it'll help your gums too. So somewhere around this video, whether below it or to the side or wherever, there's a link. Take you to a website, find the buy now link, and let's get it posted out to you straight away. Don't let your gums get any worse. Don't let people take your teeth out. Don't wait to lose your teeth. Because you'll end up having to have implants like this, and then you'll still have gum problems, so you'll still end up needing the gum doctor remedy. If you've got natural teeth, hang on to them. Look after your gums and save your teeth. Alright. If you have any questions, again, just go to the website and I'll answer your questions for you, and I look forward to helping you with your gums. Bye for now.